Hey guys, how's it going? Your real quick discussion about urinary catheters. It appears like it's a very convenient thing, especially people who are taking water pills. So their legs are very swollen up and they are on heavy duty water pills and they have to go to the bathroom every 30 minutes or something. And then now they're tired of it. So I've had the patients who just ask me the question, why can't I just have the catheter put in? So that it just stays there, it's connected to the bag, and then it conveniently drains all the urine. You know what? The problem is it really brings in this huge risk of infections. And do you guys know what the name for it is? It's CAUTI, C-A-U-T-I. UTI means urinary tract infection, and CA means catheter associated. And then, of course, the catheter, just being in there, and if it gets pulled a little bit, then it can start bleeding. So, urinary catheter, when they're placed inside to just stay there, it's a bad deal. So that's why even in people with paraplegia, which means their legs are paralyzed, in those patients who can't pee, then what we do is we still encourage straight cath, which means you catheterize, get the urine out, and then pull the catheter out. You can do it several times a day, 3-4 times a day, like every 4 hours, 6 hours. Put the catheter in, get the urine out, get the catheter out. And then throw the catheter, because these are disposable catheter. By the way, these urinary catheters in popular name, we call it as Foley catheter, because today I Googled it. It was invented by a guy called us, Dr. Foley. Frederick, I think, Basil Foley, from Minnesota, interestingly, United States in the 1930s. So it's a rubber tube. At the end of the tube, you have this balloon which can be inflated, and you can put like 10 cc of water, and then it just holds the catheter in place. So you can do that for both men and women. And very interesting technology. It's commonly used in the hospital, but then we cannot abuse it, guys. That's what it is. Okay. And a lot of people think like, hey, if I'm incontinent of urine, can I get the catheter placed? No, incontinence is not an indication for catheter placement. But if the patient has got urinary retention, which means they are unable to urinate without, a catheter, then we can use the catheter. But even then, we got to encourage in and out cath multiple times a day, but not just an indwelling Foley. And if a patient is incontinent of urine and paralyzed and laying in the bed, and because of their incontinence, the urine goes to the back in their diaper, and then now they got buttock wounds, then, we can put a indwelling Foley catheter. But then even there, what we are doing is we are trading one problem to another. So by putting a Foley catheter, then, the buttock wounds may get better, but now the Foley catheter might get infected. So we got to really think about all these things very cautiously before we do it. So Foley catheter, it's very convenient. It's good and bad, okay? That's the drive home point. And incontinence is not a reason why you can put it. Talk to you later in my next post, guys. Goodbye.